Good afternoon, everyone. You are very welcome to the Be SunSmart Sunscreen Myths and Facts webinar. The panel would be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. I will now hand you over to your host, Dr. Breda Neville, Specialist in Public Health Medicine, HSE's National Cancer Control Programme. Thank you.
Welcome everyone to today's webinar, Be SunSmart, Sunscreen Myths and Facts, which has been organised by the HSE's National Cancer Control Programme. The NCCP coordinates the implementation of the National Skin Cancer Prevention Plan 2023 to 2026, and one of the plan's key actions is to deliver and develop the annual SunSmart communications programme. The aim of the SunSmart campaign is to raise awareness of steps that you can take to protect your skin from the sun and reduce your risk of skin cancer. So we hope that today's webinar will increase your risk of the importance of being sun smart and protecting your skin in the sun, reducing your risk of skin cancer, answer any questions you may have about sunscreen and debunk some sunscreen myths. Research has consistently shown sunscreen use to be the most common sun protective behaviour amongst people in Ireland. But it's important to remember that no sunscreen can provide 100% protection and should be used alongside other forms of protection. With this in mind, we hope that today's webinar will encourage you to adopt the SunSmart 5 S's of slip-on clothing, slap-on sunscreen, slap on a wide-brimmed hat, seek shade, and slide-on sunglasses. This webinar is being recorded and a link will be sent out following the event so that you can watch it again later. The focus of this webinar is to provide information for members of the public, and so it is not specifically tailored for healthcare professionals. You can add any questions that you may have to the chat, and if possible, they will be answered by the panel at the end of the webinar. If not, one of our team will get back to you directly with an answer. It's important to note that we can't offer any individual medical advice or answer any individual medical questions. So now I'd like to welcome our first speaker, Jenny Tobin. Jenny is a scientific officer in the compliance department of the Health Products Regulatory Authority. Jenny's colleague, Emma Gilmartin, will also join Jenny in the panel discussion at the end of the webinar. But first, Jenny will speak to us about sunscreen facts.
Thank you for the introduction, and 2 seconds now and I'll just share my screen with you. So hopefully you can all see this now. Sorry. Oh, apologies if I can't see anything. Sorry, 2 seconds. Okay. Hopefully you can hear me all right. So yes, as I was introduced, my name is Jenny Tobin and I work as a scientific officer in the Health Product Regulatory Authority. And today I'll just be giving you a very brief overview of sunscreen products and, oh, apologies. Sorry, I think I'll just move my screen over here because I can't see what you guys see. So apologies about this. So share my screen. And here we go. Yeah, so as I mentioned, I work in the Health Product Regulatory Authority, so I'll just be giving a very brief background into what we do and what we regulate. Also be speaking to you kind of on a technical level, but just very general on sodium radiation and how sunscreens work, and then labeling and sun protection factor, and also about how you should be applying sunscreen and how much you apply as well as is sunscreen safe. So briefly about ourselves. So the Health Product Regulatory Authority is the competent authority in Ireland responsible for a whole range of healthcare products. I work in the cosmetics division, but we also regulate medicines, including both veterinary and medicinal products, as well as medical devices and other products which are on the right-hand side there as well. And we are located, just for info, in city centre in Dublin, and there's approximately 370 on the staff force. So a sunscreen product actually falls within the regulation of a cosmetic product. And so the primary regulation that would apply would be regulation EC number 1223 of 2009. And this is a EU legislation. So all 27 member states must comply with this regulation as well. But then we implement this further into our national law with something called SI number 440 of 2013. And in this SI, it also states that we must carry out market surveillance in conjunction with the HSE, and I'll speak further about that later. Just for info, there's other legislations that we also must comply with, but I won't go into those, but it's just to say we must follow those in relation to post-market surveillance. So our role, similar to the rest of the HPRA, is to protect consumer health, and we achieve this by both planned and reactive post-market surveillance. So won't bore you with all the details, but just a general overview. Say if there's something wrong with the product or what we call a non-compliance, we would then open a compliance case and then investigate further. We also deal with queries and issue press releases as well. And if anyone has any reaction or adverse reaction to a product, we would investigate that too, and that's called a vigilance case. And we also do inspections as well of both manufacturers and distributors of cosmetic products, and would attend European meetings to discuss cosmetic products at a European level with other member states as well. So what we're all here today to discuss is about sunscreen. So our role specifically in relation to sunscreen, so as I mentioned, is we work alongside with the HSE, or specifically within that, we work with the National Environmental Health Service and the Public Analyst Labs. And it is the National Environmental Health Service who actually go out and they sample sunscreen products from retailers, and then they would send those products to the lab for testing. So the lab would be looking at the UV filters and if the SPF claimed on the product is actually what is within the product itself. So say, for example, a non-compliance was identified. So say a UV filter is above the permitted concentration limit. This would be considered a non-compliance, and we would open a case to investigate. So we would follow up with the EURP, or that is the EU responsible person. So they're responsible for placing that product on the market. And we do something called a corrective and preventive action plan to address these non-compliances. So if we kept with that example where the concentration was above the permitted level for the UV filter, potentially that will result in a recall of that product. So then to get into the kind of technical aspects now, so sun radiation and how sunscreen works. So there are three main UV radiations, so A, B, and C, but UVC doesn't get past the ozone layers. The ones that we're mainly concerned with is UVA and UVB. So UVB is the shorter wavelength radiation, whereas UVA is the longer one. So it's UVB that causes that sunburn and your skin reddening, and it is also the main contributor of the risk of cancer as well. However, the risk of UVA cannot be neglected. And then UVA radiation actually penetrates deeper into the skin, and this results in that premature aging of the skin. So how I like to remember is UVB, the B stands for burning, and the UVA, the A stands for aging. So on to the next one. So the UV index. So this kind of measures the strength of the sun's rays. So on a technical level, it would measure the level of the UVA or UV radiation that is expected at the Earth's surface. So the higher the level, the less time it takes for the skin to burn, and the greater the risk of sun damage, which ultimately can lead to skin cancer. So we would recommend anything with a sun score of above 3 that you would be requiring to wear your SPF. And on most actually weather apps nowadays, if you scroll to the bottom, it should give you the UV score for the day. So if you look at that and you see that it has a UV score of above 3, we would be recommending that you do put on your sunscreen for that day. Sunscreen, or the UV radiation, is at its highest during midday, so the hours of 11 to kind of 3 p.m., typically during the from April to September. So particularly during those times, you should be ensuring that you have sunscreen on, and especially when the UV index goes above 8, we would say to be avoiding going outside all together, or going into the shade, and ensure you are wearing protective clothing as well, and sunscreen and your hat. So how does sunscreen work? So there are two main types of sunscreens. So those being a chemical, also called organic, and a physical, inorganic. And this physical one is also referred to as a mineral sunscreen. So this chemical sunscreen works by absorbing the radiation and converting that to heat, and then the skin then releases that energy. So if you look at the back of your cosmetic product, there should be a list of ingredients, and on that, all the UV filters will be listed. So if you see octocrylene listed as a UV filter, it would indicate that that is a chemical sunscreen. Whereas a physical sunscreen or a mineral sunscreen is one where zinc oxide or titanium dioxide are commonly the active ingredients within them. And these work by creating a physical barrier on the skin's layer, which reflects and scatters the radiation. It's not to say that one is better than the other. They both work equally well. Like in the past, the physical or the minerals ones used to be known for like that white cast effect, but they have, in fairness, like the new formulations have kind of moved away for that, and they will be very similar now to the chemical sunscreens. So it's honestly up to just your personal preference and your skin type as well, whichever you feel works best for it. Same with like creams, the sprays, the oils. It's just down to yourself and what you think works best for you. So labeling and sun protection factor. So cosmetic products are required to have specific labeling requirements on the product label. So one of the things, like if you go home and you take out your cosmetic product, it should have something called a RP name and address. So this is the company name should be on the product, and it has to have an address listed within the EEA or in Northern Ireland. It also has to have that list of ingredients. Again, that's where you'll see your UV filters listed. Any precautions will also have to be listed there too. And in particular, it has to have something called a minimum date of durability or a period after opening. So if you see this little open jar symbol there, and generally on a sunscreen product, it will have a PAO of 12 months. So that is to indicate that the cosmetic product is safe for use within 12 months of opening that product. So a good rule for thumb is if you're using a sunscreen product this summer, you shouldn't really be using it the following summer, because the 12 months will have passed and the product will have expired. So then just specifically in relation to sunscreens, there are additional recommendations for sunscreen labeling. So claims in relation to sunscreen should be simple, unambiguous, and meaningful. So that's to say that if an SPF says it's SPF 30, there's UVA, it should be very clear on the label. You should see it from literally just picking it up that that's SPF 30 and it gives UVA protection. And it should also be based on standardized reproducible criteria. So if the company were to test the product and we were to test the product, we should be getting the same results as well. So a sunscreen which claims UVA protection must provide a certain level of protection in line with EU guidelines. So in order to get that UVA symbol there in a little circle, it has to have achieved a minimum of a third. The UVA protection must be a third of that of the SPF. So if it doesn't have that, meets that minimum requirement, it won't have that UVA symbol. I know there is also those UVA 5-star ratings as well. I think that's established by retailers. That's not one that we ourselves would be checking for to make sure it's compliant, because it's not an EU recommendation. So if there was the UVA 5-star and there's a UVA in a circle, I would preferably go for the one in the circle, because that's the one that's in compliance with EU recommendations. And then the claim should also not be used to imply that products have characteristics which they do not have. So I'll go further into that now. So a product recommended labeling for specific sunscreen. So it should have a warning indicate that the sunscreen products do not provide 100% protection. So they'll generally say like, children and babies should avoid direct sunlight, or this product does not avoid, or action should be taken to prevent going out in direct sun. This sunscreen product does not prevent 100% protection. Those claims should also be on the product, as well as instructions for use that will ensure that the claims made for effectiveness of the product can be achieved. So that's to say, like, it should say, make sure you're applying this product before going outside, or frequently reapply this product when you go outside, so optimally every 2 hours. Those should also be on the label of a cosmetic or on a sunscreen product. And then instructions for use to ensure that sufficient quantity is applied on the skin to achieve effectiveness for the claim. So that's to say, like, it should either have a pictorial, or sometimes they come with measuring devices to say this is the amount of product you need to apply in order to achieve that claimed SPF or the claimed UVA protection. And it also should have this warning that reducing the quantity will lower the level of protection significantly as well. So there are four main categories of SPF protection. So those being low, medium, high, and very high. So anything that has a claim, SPF claim of 6 or 10 will be considered a low protection SPF. Anything with 15, 20, or 25 would be a medium. 30 or 50 would fall within the high, and then anything from 50 plus would be considered a very high protection. So your SPF should have both the SPF, and it also should indicate if it's low, medium, very high, or high protection as well on the sunscreen product. So what is SPF? So the SPF is actually only in relation to the UVB radiation. So it's a measure of a product's ability to prevent UVB radiation from damaging the skin. So no SPF can completely block off all UVB rays. So to provide high protection of health, sunscreen should have both UVB and UVA radiation protection. So SPF, again, only refers to that UVB. However, sunscreen should contain both UVB and UVA protection. I know a lot of like makeup nowadays will have the SPF of 30 claim on it, but again, that's only in relation to the UVB, so it'll only be protecting you against the UVB radiation. So we would also suggest that in conjunction with those products you are applying a sunscreen, to make sure you're getting ultimate protection against UVB and UVA radiation. So SPF itself. So I remember when I was younger, I used to think if it was 30 degrees outside, you would put on your SPF 30 and you'd be grand, but that's not actually how it works. And this is technically on a level of what it means. So SPF 15 absorbs 93% of UVB radiation, whereas SPF 30 absorbs 97%, and SPF 50 absorbs 98% of UVB radiation. You're probably looking at that and thinking there's not much of a difference between SPF 15 and SPF 50. But if you look at it from the other point of view, SPF 15 doesn't absorb 7% of UVB radiation, whereas SPF 50 doesn't absorb only 2% of UVB radiation. So that's why we would recommend for adults to be wearing a minimum of SPF 30 and for children to be wearing a minimum of SPF 50. So applying sunscreen. So on the same note, who should be applying sunscreen? Everyone should be, particularly your stereotypical Irish person with pale hair or pale skin, red hair, freckles. We have a higher risk of cancer, so we would recommend that you would be wearing sunscreen. Particularly elderly and children should be wearing sunscreen, but do review the labeling to determine sunscreen suitability for babies. Oftentimes, a lot of companies now have specific formulation for babies, so opt for those if you can, to make sure the children's needs are met. People taking photosensitizing medication as well should ensure that they're wearing sunscreen, and also products like retinols, chemical peels like AHAs and BHAs. They also increase your sensitivity to the sun. So we would be recommending that if you're applying those at night to ensure that you're wearing SPF the next day as well. So how much sunscreen should you be applying? So for a 2-year-old, we would recommend on average at a minimum that you be applying 2 teaspoons for the entire body, whereas up to an adult, the average adult should be applying a minimum of 6 teaspoons for the entire body as well. So to reach the protection level indicated by the SPF, sunscreen products must be applied in quantities similar to the ones that they use for testing. So that testing limit of use is 2 milligrams per centimeter squared. So that's where we got that 6 teaspoons from. So this would be approximately 36 grams for the entire body you should be applying. So just to note, applying a smaller quantity of a sunscreen product leads to a disproportionate reduction in protection. So for example, if the quantity applied is reduced by half, so you're only applying 3 teaspoons of the product, the protection may fall by as much as 2/3. So just be sure that you are actually like applying as much sunscreen as you need. Don't be skimping out and being like, oh, trying to save your sunscreen. Apply that minimum of your 6 teaspoons to ensure you're actually getting that SPF of 30 or SPF of 50 that's been claimed on the label. So how do I apply the sunscreen? So sunscreen should be applied to dry skin at least 20 minutes before exposure to the sun, or as instructed on the label. So if you're just out of the shower, make sure you dry yourself, and then 20 minutes before you should be putting your sunscreen on. And it's important to emphasize that sunscreen should be reapplied every 2 hours, or as instructed on the label. Even those once a day sunscreens, you need to be applying those every 2 hours as well. And you need to increase that frequency of reapplication if you are perspiring, swimming, or toweling as well. So in addition to sunscreens, we would also recommend that you be seeking shade, especially when that UV index is high. So cover the skin, so to wear tops, to avoid peak sunlight hours. So again, as mentioned, between the hours of 11 a.m. and 3 p.m. and ensure that you're wearing sunglasses with UV protection. So is sunscreen safe? So that legislation that I mentioned earlier on of the European Regulation 1223 of 2009, in it states there's a specific list where it'll cosmetic or UV filters that have been found to be safe are listed within this Annex 6. And it also lists side by side the maximum concentration of that UV filter that is permitted. So the company can only use the UV filters that are listed on this in Annex 6 and up to those concentrations, as those concentrations have been found to be safe for use in humans. So in addition to that, the EURP must have this thing called a cosmetic product safety report completed prior to placing the product on the market. So within that safety report, they have to have justification and evidence of all the claims. So they have to prove that they've met the SPF criteria that they claim, that they've met the minimum UVA requirements, that any additional claims that they made, they all have to be justified within this safety report. And us as competent authority, we can review the safety report for compliance to ensure that the information is actually correct. And then, so who exactly comes up with those limits and determines the maximum concentration of those UV filter limits? It's this committee called the Scientific Committee on Consumer Safety. So this committee is responsible for the health and safety of the chemicals. So they provide opinions, and then based on those opinions, we would implement those into our national laws. So they, for example, have stated that for octocrylene, they have said that it's safe up to a concentration of 10%. And then for homosalate, very specifically, they said it's safe for up to 7.34% in face creams and pump sprays. So just to say that these are regulated, or these are regularly updated in our regulations. So any recommendations that the SCCC provides to us, we are constantly updating them within our regulations. So our most recent update there was in April. So we are constantly updating them based on these recommendations from the SCCS. So in conclusion, your cosmetic products on the market will be considered safe. So this comes to the end of things. This is, if you want further information on sunscreens, you can find it available on our website. And if you do have any questions or anything you want to ask us, you can also email us at cosmetics@hra.ie. And they're just the references from the slide. And thank you for your time. I know it's very long, so I hope it didn't bore you, but I hope you found some of that useful. Thank you. I'll just stop sharing.
Thanks, Jenny. That was a really informative presentation. So our next speaker is Dr. Aoife Lally. So Dr. Lally is a consultant dermatologist and the chair of the melanoma multidisciplinary team in St. Vincent's University Hospital. She's also an adjunct professor in the School of Medicine in UCD and a spokesperson for the 2024 SunSmart campaign. And today, Dr. Lally is going to speak to us about sunscreen myths.
Hello, as mentioned, my name is Dr. Aoife Lally and I'm a consultant dermatologist at St. Vincent's University Hospital. And my main area of clinical practice and research is on skin cancer. I'm delighted to be a spokesperson again this year for the SunSmart campaign. Over the next few minutes, I'm going to deal with a few questions that are very common and topical, particularly at this time of year with regard to sun protection measures. So we often get asked about using sunscreen and whether that's necessary if somebody doesn't burn very easily. The majority of people in Ireland are fair-skinned, with skin that has a tendency towards burning, and particularly burning before then tanning. So people who tan more easily, that doesn't mean that they don't have to use sun protection measures. Tanning of any kind damages the skin cells, and there's no such thing as a safe or a healthy tan. It's very important to realize that tanning in itself doesn't protect against sunburn, and all kinds of exposure to the sun does increase somebody's risk of skin cancer later in life. Very importantly, tanning from indoor tanning machines is a particularly bad thing. We know from lots of research over the years that exposure to indoor tanning beds under the age of 35 significantly increases the risk of the most serious type of skin cancer, melanoma. There's a 75% increased risk of melanoma in those who use sunbeds at a young age. So it's important to realize that sun protection measures, including the use of sunscreen, are still required, even if people have a skin type that's more likely to tan than burn. And then following on from this, those people with dark colored skin equally do need to protect themselves from sun exposure. So even if people don't burn, they still need to use sun protection measures, as dark-skinned people still have a smaller risk of skin cancer, but it's still there. I think when we're talking about sunscreen, it's important to realize it's just one of the factors in sun protection measures. So the key thing is to really avoid sun exposure where possible, to keep out of the sun during the peak hours between 11 and 3, to seek the shade, wear a hat, cover up with clothing, and to use sunglasses. And then on the bits of skin that are exposed, to apply a broad spectrum sunscreen and to reapply it. Reapplying it is key, because a one-off application in the morning won't do if somebody's going to be out and about throughout the day, and particularly if somebody's going to be swimming or water sports or whatever, reapplication is very important. A question that often comes up is whether or not somebody's makeup with a bit of sunscreen in it is sufficient, and I would say it isn't. People who don't have very dry skin can just use a sunscreen instead of their regular moisturizer, and use that under their makeup. It's great if your makeup has a sunscreen in it or SPF in it, but it's usually not sufficient. And the important thing is the need for reapplication. And I often recommend to my patients that they can use a spray on sunscreen, so they can reapply that over their makeup throughout the day as needed. But certainly makeup alone won't have a sufficient level of sun protection in it, even if it has a sunscreen. And again, to reiterate about the other methods of sun protection, seeking shade, trying not to get a tan, being covered up, wearing a hat. It's very important to follow those and just not rely on sunscreen alone. Vitamin D is a very topical question. I often get asked whether or not people are depriving themselves of vitamin D if they wear sunscreen. There's been several studies looking at this, and there's very little evidence that sunscreen use alone will reduce levels of vitamin D. So I say to my patients that if they're worried about vitamin D levels, to take a supplement, can get a blood test if necessary, but to check vitamin D levels and take a supplement, and not to rely on sun exposure for vitamin D production. We know that sun exposure increases the risk of skin cancer, tanning. Sun exposure causes damage to the DNA within the cells in your skin, and this predisposes to skin cancer. And certainly we shouldn't be relying on sun exposure to boost our vitamin D levels. It certainly is not something that we'd recommend. And you know, if there's a concern about vitamin D, I always say get a test and test the levels and then take a supplement as needed. Many of us suffer with low vitamin D levels, and supplementation is possible through either tablets or fortified milk and dairy products, etc. Just because something costs more money doesn't mean that it's necessarily a better product. Because, as I've mentioned, it's very important to reapply sunscreen. I think the best sunscreen to use is one that agrees with your skin, that you're comfortable using, and that it's cost effective enough that you won't be trying to use it sparingly, and that you'll apply it in sufficient amounts, and therefore your skin will be better protected. So the important things to look at are that there's broad spectrum coverage, so giving you protection against UVB and UVA. I usually recommend an SPF of 30 or greater, so a minimum of 30, and reapplying it. So the key is that it's something you like using, it's something that feels nice on your skin, and that you're happy to reapply it frequently throughout the day. They're kind of the key things with a sunscreen, and you don't necessarily need to pay more in order to achieve that. Another thing get asked about are sunscreens in children or babies. And I think the key thing for children and babies, as I've mentioned already, is covering up, and rash vests or clothing with UV protection in it, which is very widely available in lots of shops now. So hats and tops and shorts that have sun protection factor in them, they're very, very useful, particularly when children are out and about during the day. If they're in and out of water, you're not racing around trying to reapply sunscreen to those parts of the body. So I think that's the key thing to focus on, that children shouldn't be out in direct sunlight for long periods of time. Particularly babies, they should be wearing hats, covered up in the shade. And children, as I say, clothing with UV protection within it is very helpful. And again, avoiding the peak sunlight sun hours of between 11 and 3, and reapplying sunscreen, particularly when there's water sports and swimming involved. And this kind of, I've already answered this question, I suppose, several times, that one application of sunscreen certainly doesn't last a day. And there may be some sunscreens that market themselves as being day-long, one-off application. That, in truth, doesn't really work. You really should apply sunscreen every 2 to 3 hours, and apply sufficient amounts of it to cover the skin adequately and protect adequately from sun damage. I tell my patients to put sunscreen on every day, all year round, on the face and the back of the hands, because they're the areas that are exposed year round. So you get chronic sun exposure year round. And then in the summer, there's more skin exposed, just when we hopefully get some nicer weather. And so it's important to apply sunscreen on the all exposed areas of skin once the weather improves. But year round, I would suggest sunscreen on the face and the backs of the hands, and then if you're out during the day, to reapply it. So thanks very much for listening, and I know there's going to be some time for questions later on. Thanks again.
Thanks very much, Dr. Lally. So our final speaker is Maria McHenry. Maria is a Cancer Prevention Officer with the HSE's National Cancer Control Programme, and she coordinates the implementation of the National Skin Cancer Prevention Plan. And Maria is going to talk to us about SunSmart.
Brita. I'm just going to start sharing my slides, so just bear with me a moment. So hope everyone can see that okay. So as Brita said, I'm just going to be giving you a quick overview of the SunSmart campaign and the importance of following the SunSmart 5 S's. I know today has been mainly focused about sunscreen, but it's really important to highlight the SunSmart 5 S's. So our SunSmart campaign runs annually from April to September every year, and it promotes building skin cancer prevention behaviours into our everyday routine. So the HSE, the National Cancer Control Programme, in collaboration with Healthy Ireland and also cross-sectorial partners, are working together to support people to protect their skin from the sun. So the aim of the campaign is to increase our awareness of steps we can all take to protect our skin from the sun and to reduce our risk of skin cancer in Ireland, and also to highlight the dangers of using sunbeds and to never use sunbeds. So I suppose as part of the campaign, we would have information for the general population, for everyone, but there are specific at-risk groups we're specifically targeting as part of the plan as well. So we have parents of children, teenagers and young adults, outdoor workers, those who would spend a lot of time outdoors, with sporting activities or recreation activities, and also sunbed users. So we have a wide range of resources, imagery, videos available on the SunSmart hub at hse.ie/SunSmart. You can also order resources free of charge from helppromotion.ie. So we have posters, leaflets,
all on healthpromotion.ie. So you can choose cancer from the drop-down menu and you'll see all of our resources available there, as well as more broad kind of cancer risk reduction resources and early diagnosis information resources on that section as well. Our annual radio campaign is also about to kick off. So that kicks off this Friday, the 24th of May, and it runs till August time. Our social media campaign started in April, so you can engage with us on social media by searching the hashtag SunSmart. I've also included the social media handles there if you want to find out more information or to share some of our posts from social media. So I suppose as part of the campaign, we're trying to highlight that skin cancer is the most common cancer here in Ireland. I think in Ireland we often think, I suppose, that with the change of the weather here and that it's often cloudy or overcast, that we're not going to get sunburnt. Not even thinking about skin cancer, but it is the most common cancer in Ireland. And even though it can be cloudy, UV radiation can still penetrate through cloud and also through glass. So I suppose people often think, oh, if it's cloudy, I don't need to protect my skin. And people often get confused between the heat that we feel, so the temperature, they think that's associated with UV. So the heat and temperature is associated with infrared radiation, and then UV radiation is something that we can't see or feel. So it's really, really important to highlight that, just because the temperature might not be overly warm and it could be cloudy outside. Generally speaking, between the months of April to September, the UV index can be 3 or above, so we do need to protect our skin between those months. So as I said, skin cancer is the most common form of cancer in Ireland. There's just over 11,000 cases annually. The number of people being diagnosed with skin cancer is on the increase, so it is rising year on year. But I suppose it is also really important to highlight that it is one of the most preventable cancers. So by protecting our skin from the sun and not using sunbeds, we can significantly reduce our risk. So I suppose we're not telling people to stay inside and not go out into the sunshine. I suppose it is while you are outside to follow the sun protection behaviours and to look after our skin while we're outside. The main cause is UV radiation from the sun and also from artificial sources such as sunbeds. And I suppose we know that overexposure to UV radiation can damage your skin cells. And this, I suppose, is cumulative. So this can increase our risk every time our skin is exposed. So it doesn't just happen once and then we can get a skin cancer. It can happen years later. So I suppose from a young age, we really do need to look after our skin and protect our skin. But it's never too late to start protecting our skin. So I suppose today we're highlighting the importance of the SunSmart 5S's and what we can all do every day. So the 5S's are, so the first is the slip-on clothing that covers our skin. So that could be long sleeves, collared t-shirts, a slop-on sunscreen on exposed areas. So using factor 30 plus for adults and 50 plus for children. I know I've discussed a lot here about sunscreen today and all the various elements that you need to consider when you're looking at sunscreen. But I suppose it's not just sunscreen we need to be using. We need to be following the 5S's. So the clothing, to slap on a wide brimmed hat, to seek shade, especially if outdoors between 11 a.m. and 3 p.m. when the UV can be at its strongest, and then to slide on sunglasses to protect our eyes. As well as the 5S's, we would encourage people to check the UV index. So you can check it at the Met Éireann website, linked there, or on their app. So every day on Met Éireann, they do highlight what the UV index is. So if it's 3 or above, we do need to protect our skin and follow the SunSmart 5S's. And as well as the 5S's, I suppose we're also trying to highlight that it's never okay to use sunbeds, and sunbeds produce UV radiation, can damage our skin. So they can cause sunburn, premature skin aging, and it can also significantly increase our risk of developing skin cancer. So for more information and to learn how to protect yourself and your family this summer, you can visit the SunSmart Hub at hsc.ie/SunSmart, or you can check out the hashtag SunSmart on social media. Thanks everyone.
Thanks, Maria, for another really informative presentation. So now we'll have some questions for our panel. So the first question I have here is for Jenny and Emmett. So somebody has asked, is there any regulation of non-European sunscreens, or where could we get information around this? For example, Korean and other Asian facial sunscreens are very popular.
Yes, so that depends really. We can't answer that, I suppose, for every product on the market, but there are a lot of Korean products, and as you stated, however, some of them are compliant with EU legislation. So, as Jenny said, it's important for a product to be compliant on the EU market. It must have an EU responsible person. So, if these particular products have originated from Korea, they must have an EU responsible person name and address on the labeling. If, however, an individual is importing directly from a Korean website, for instance, and it's a Korean product that doesn't have an EU address, then there will be concerns that that may not be compliant with EU regulatory requirements. So again, it would require further investigation, and we can't answer that for every particular product directly, but it's always just a good check for consumers to be aware that in order to be compliant with EU legislation, it must contain an EU responsible person name and address.
Thanks so much. And actually another question for Jenny or Emmett. So if the label has a UVA in a circle with 5 stars in the circle, is that EU regulated, or should we just buy ones that just have the UVA in the circle and ignore the ones with the stars?
So if it has the UVA symbol in that circle, that means it does comply with EU recommendations. So even if it does has the UVA 5-star rating, as long as it has that UVA in the circle as well, that means it's compliant with, it meets the minimum requirements of the EU recommendations. So we would recommend to look out for that symbol, but if it has both, that's even better.
Okay, thanks, Jenny. So I have a question for Dr. Lally here. What key messages would you give to people who live in a very overcast country like Ireland, where it can rain a lot and who often feel they're not at risk?
Well, I suppose that's the problem with living in a country like this, where every time there's a drop of sunshine, everybody runs out to expose themselves to it. UVA comes through the clouds. So on a cloudy day all year round, you get exposure to UVA. I think we need to be sensible and get into the habit of using sun protection measures all year round. Key things for me are wearing a hat, particularly a wide brimmed hat, something that covers the ears. And that's really important for people as they get older, particularly men who may have less hair than they had previously. But the ears are a very common site of sun damage, as is the scalp. It's where we see a lot of skin cancers in older men. And I think wearing sun factor on the chronically exposed sites every day, just all through the year, get you into good habits. So face and backs of the hands, and have the sunscreen, in the whole table, in the bathroom, beside the toothbrush and toothpaste, so that you get into the habit of using it every day. I think, we're living in a cloudy country, but we're in the top 10 for skin cancer rates in the world, and that's it's Australia, New Zealand, Scandinavian countries, and then us. We're always in the top 10 for skin cancer rates, unfortunately.
And so someone, in keeping with that question, someone else has asked, should persons with red hair wear factor 50 all year round? So there'll be yes, really, from
broad spectrum sunscreen. So factor 30 UVB protection, star rating for the UVA all year round. Yes.
And there's a couple of questions actually for you in relation to children as well, which you've addressed really in your presentation. But one was, is there still a recommendation that babies under 6 months would wear no sunscreen, or is mineral sunscreen recommended for them now?
I think I'm not a pediatric dermatologist. I think mineral sunscreens they give that chalky appearance. So that's why a lot of older people don't like using them. But I think the key thing for babies is they're covered up, and they shouldn't be in direct sunlight. And there's very good clothing available now for children, including babies. So UV protective clothing, you can get all-in-one suits, hats, and then keep them in the shade, the UV protective shades for prams. And really, babies shouldn't be in the sun, but a mineral sunscreen on exposed sites if necessary.
Okay, thank you. Just for Jenny and Emmett, you addressed this really, Jenny, as well, but I suppose it's one that comes up a good bit, so it's probably no harm just to reiterate. So someone has asked, there's a lot of talk on social media at the moment in relation to the chemicals found in sunscreen, and that this could be adding to our cancer risks. So are the ingredients in sunscreen safe?
Can you hear me? It says I'm muted. Yeah, you can't hear it. Yeah, so as I mentioned during my presentation, that committee, the scientific, so the SCCS, they are constantly reviewing and these chemicals to see if they are safe. So they'll review all evidence, and then if they're not, they'll remove them then from that list I mentioned, that for UV filters, only those that are considered safe can be on that list. So if they, following new insights, they're like, oh no, it's not safe, we then will remove it from it. But everything that's on that UV filter that's in Annex 6, they are all considered safe, those UV filters, by this committee. And they've taken all evidence as well. And they also provide maximum concentrations, like so up to a certain limit, those ingredients are found to be safe, and they'll include those recommendations. And that's what, when we send those products for testing, that's what we're testing for, to make sure that those sunscreen products have those UV filters below that maximum limit. So all the products on the market, they'll have to, like that's a cosmetic safety report that I mentioned, they'll have to demonstrate that those UV filters are below those limits. So they will be, those products are considered safe by at a EU standard.
That's very reassuring for people. So thank you, Jenny. Again, for Dr. Lally, we have a question on, somebody has asked, do you have any top tips for people who have had a transplant around the sun as they're using Prograf, etc.?
I think that's a really great question, because in addition to fair skin, UV exposure, and all of the well-known risk factors, patients who are immunosuppressed for whatever reason, the largest group probably being solid organ transplant recipients, are at an increased risk of developing skin cancer, because their immune system is less able to provide a good defense. And the same goes for certain groups with hematological malignancies, and those who might be immunosuppressed for other reasons, inflammatory bowel disease, certain rheumatological conditions, or neurological conditions. And really the key thing here is to engage in good sun protection measures, as we've been mentioning throughout the afternoon, covering up, so a hat, seeking the shade, keeping clothes on, particularly UV protective clothing, sun factor on the bits that are exposed, and sunglasses. So it's really those good habits of protecting yourself from the sun, but being aware that there is an increased risk of skin cancer, and having a lower threshold to get medical attention if there is a non-healing lesion, so something that hasn't, if a cut or a bang hasn't healed after 3 or 4 months, or if you've got something that grows very quickly on the skin. And of course, a changing mole or a new mole that looks different. So just being very vigilant about changes on the skin is also important.
And another one here is just, so this is something that we get a lot as well, is when putting on moisturizer, should we wait to put on our SPF, or what's the correct order in terms of moisturizer and sunscreen and makeup?
Well, just from a practical point of view, I say if you can get away with just using sunscreen, if your skin isn't particularly needing a moisturizer, that'll probably do the job and reduces the amount of products you're putting on. So I would normally say you put a sun factor on and wait a couple of minutes to put on the makeup, but that's from a personal point of view. And if you need a moisturizer as well, then fine. But the more things you're putting on, the less likely you're going to probably forget the sunscreen. So prioritize the sunscreen. And there are some very moisturizing facial sunscreens available. That's my opinion.
Yep. See now what else we have. Somebody has asked again, Dr. Lally, I know you're not a pediatrician, but I suppose it applies. They've asked, what advice give to parents of children with darker skin from Africa and Southeast Asia regarding sunscreen? I suppose it applies to people of all ages with darker skin anyway. So
yeah, I mean, it's it's very true that people with darker skin have a lower rate of skin cancer, but people with darker skin will still tan with UV exposure. So it's about that balance, and certainly still protecting the skin is important. Skin cancer rates, as I say, are far lower in patients or people with darker skin, and they probably need to look at different sites. There's certain sites that are more unrelated to UV exposure, like the nails and the feet and the hands. People with darker skin are more likely to get skin cancer at those sites, which isn't related to sun exposure. But overall, protecting yourself from the sun is a good idea to reduce skin damage.
I think we have time for maybe 1 or 2 more questions. Somebody has asked about mole mapping. What are your thoughts on mole mapping, and is there a HSE service for mole mapping?
To my knowledge, there isn't a HSE service for mole mapping, and I'm a little bit cautious because mole mapping means different things to different people. I think if you need to see a dermatologist about your skin, the most important thing is to have a full skin exam and have individual moles examined by a little a magnifying torch called a dermatoscope, which allows us to see structures just in the slightly deeper in the skin, and helps us to look at the pattern of moles that people are making and spot early signs of melanoma. Mole mapping, it really depends on what the person means. So there are certain groups who can benefit from serial photographs, serial dermoscopy photographs. So that tool that I've mentioned, you can take photographs and record those images. And that's just a small subset of patients who may benefit from that, people with lots of moles and a family history of melanoma. So the vast majority of people don't really need to have mole mapping. What they need to do is have a look at their skin. The Irish Cancer Society, the Irish Skin Foundation all have good leaflets on how you can examine those more difficult to see areas, such as the back, and using mirrors and changes to look out for. So mole mapping, to my knowledge, isn't available in any site in Ireland in a public hospital, and I think a tiny minority of people may benefit from it. It's not something that the general public really needs. Sun protection is far more important, and examining your own skin and knowing what the baseline looks like.
Absolutely. So we have another question for Jenny and Emmett. So someone's asked, on some sunscreens, so you have sometimes you have the star rating, but some of the sunscreens will have the PA rating followed by the pluses. So for example, you might have PA and 3 pluses. So what does that mean in terms of UV protection, and how can people interpret that?
So I don't think on my presentation where I mentioned the different levels of protection, low, medium, high, very high, the PPA doesn't actually fall within that. That's not one that we recognize within the EU. I think that's a Korean, how they might score their sunscreen products, but it's not one within the EU that we recognize. 50 plus is the maximum one that we would recognize up to. And as Emmett mentioned, that's not to say that, say, if you potentially import that product, they could have brought it into compliance with EU legislation and have updated their labeling since. But if you are buying a product from a Korean website itself, they have different legislation requirements as we do. So that would only be in compliance with the legislation that from the country that you purchased it from. It wouldn't be in compliance if it has only the 50 plus PA. That wouldn't be in compliance with our legislation.
Okay, thanks, Jenny. And again, for Dr. Lally, I just had a question from someone who said they're in their 60s and they've had multiple BCCs or basal cell carcinomas, and they're wondering, is there any point in taking precautions from this point on?
Well, I think there's always a point. Somebody in their 60s is going to live for another 30 plus years, most likely. And therefore it is important to reduce risk as much as possible. And so I always recommend that my older patients use sun protection measures, particularly the hat, and covering up and avoiding peak sun, seeking the shade, and then sun factor on the areas that are exposed. I think it isn't too late in your 60s. That's very young. And there's lots of more skin cancers that are going to appear. So you want to really reduce that risk by modifying sun exposure behavior.
Thank you. And just a question for Maria now. So someone's asked, where can people find out more about the SunSmart campaign, and where can they get more resources?
So we have a lot of information on hse.ie/SunSmart. So we have a link to resources, previous webinars that we've played, as well as information about our SunSmart campaign. We'll also be including there any future webinars, events, or initiatives that we're running, so you can keep an eye on that. Or if you search the hashtag SunSmart on our social media channels, you'll be able to find all of our information. We also have a newsletter that goes out quarterly as part of the Irish Cancer Prevention Network. So if anyone wants to sign up for that, they can email prevention@cancercontrol.ie, and we can add them to the mailing list.
Thanks, Maria. So lots of questions coming in there, but I think we're probably just about out of time. So that is supposed to, Yeah, so just to remind everyone that if you want to get more information on the SunSmart campaign or protect your skin from the sun, you can check out hsc.ie/SunSmart or #SunSmart. And just again to thank all our panelists for today, Dr. Aoife Lally, Jenny Tobin, Emmett Gilmartin, and Maria McHenry.